Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Henry Pratama. I am from Malaya University. In this video, I will tell you a little bit about COVID-19 or coronavirus. So let's enjoy this video. What is the novel coronavirus? A novel coronavirus is a new strain of coronavirus. The disease caused by the novel coronavirus first identified in Wuhan, Chinese, has been named coronavirus disease 2019 or COVID-19. So for virus and CO stand for corona, V for virus, and D for disease. Formally, this disease was referred to as 2019 novel coronavirus or COVID-19 and CoV. The COVID-19 virus and virus linked to the same family of virus as acute respiratory syndrome, SARS, and some types of common cold. And how does the novel coronavirus spread? The virus is transmitted through direct contact with respiratory droplet of an infection person, generally through and touching surface contaminated with the virus. The virus might survive on surface for several hours, but simple disinfectant can kill it. And what the symptom of novel coronavirus? Symptoms can include fever, cough, short of breath, and more severe case infection can cause pneumonia or breathing difficulties. More rarely, the disease can be fatal. The symptoms are similar to the flu, influenza, or the common cold, which are a lot more common than novel coronavirus. This is my testing is required to confirm in someone has novel coronavirus. It's important to remember that key prevention measures are the same: frequent hand washing and respiratory hygiene. Cover your cough or sneeze with a flag, elbow, or tissue. Then throw away the tissue into closed bin. Also, there is a vaccine for the flu, so remember to keep yourself and your child of that vaccination. How can I avoid the risk of infection? Here are 4 precautions you and your family can take to avoid infection. Number 1, wash your hand frequently using soap and water or an alcohol-based hand rub. Number 2, cover mouth and nose with a flex, elbow, or tissue when coughing or sneezing. Dispose of used tissue immediately. Number 3, avoid close contact with anyone who has cold or flu-like symptoms. Number 5, seek medical care early if you or your child has a fever, cough, or difficulty breathing. What is the best way to wash hand properly? Step 1, wet hand with running water. Step 2, apply enough soap to cover wet hand. Step 3, scrub all surface of the hand, include back of hand between finger and underneath for at least 20 seconds. Step 4, rinse thoroughly with running water. Step 5, dry hand with a clean cloth or single-use towel. Wash your hand often, especially before eating, after blowing your nose, coughing or sneezing, and going to the bathroom. Use soap when water are not readily available. Use an alcohol-based hand sanitizer with less 60% alcohol. Always wash hand with soap and water if hands are visibly dirty. So, wear a medical mask. Mask help stop the COVID-19 virus from spreading. To help to take the best discussion for your family, we have written up the latest expert information on mask and the COVID-19, how to wear and look after mask correctly, and idea on how to successfully introduce them to your family. And does the novel coronavirus affect children. This is a new virus and we don't know yet about how it affects children or pregnant women. We know it is possible for people of any age to be infected with the virus, but so far there have been relatively few cases of the novel coronavirus reported among children. The virus is fatal in rare cases so far, mainly among people with existing medical conditions. What should I do if my child has symptoms of novel coronavirus? Seek medical attention, but remember that the symptoms of novel coronavirus, such as cough or fever, can be similar to those of the flu or the common cold, with a lot more frequent. Continue to follow good hand and respiratory hygiene practice like regular hand washing and keep your child up to date with vaccination so that your child is protected against other virus and bacteria causing disease. As with the respiratory infection like the flu, seek care early if you or your child are having symptoms and try to avoid going to public places, workplace, school, public transport to prevent spread to others. What should I do if a family member displays symptoms? You should seek medical care only if you or your child has a fever, cold, or difficulty breathing. Consider calling a help to tell you health care provider if you have traveled to an novel coronavirus has been reported of if you have been in close contact with someone who has traveled from one of these are and has respiratory symptoms. What precautions should I take for my family if we travel? Anyone planning a trip overseas should always check the travel advisory for their destination country for any restriction on entry, quarantine requirements on entry, or other travel advice. In addition to taking standard travel precautions and in order to avoid being quarantined or data re-entry in your home country, you are also advised to check the latest COVID-19 update on the International Air Transport Association website, which includes a list of countries and restoration measures. While traveling, parents should follow standard hygienic measures for themselves and their children. Wash hand frequently or use the alcohol-based sanitizer where less than 60% alcohol. Practice good respiratory hygiene. Cover your mouth and nose with your band, elbow or tissue when you cough or sneeze, and immediately dispose of the tissue. And avoid close contact with anyone who is coughing or sneezing. In addition, it is recommended that parents always carry a hand sanitizer pack or disposable tissue and disinfecting wipes. Okay, thank you. That was my video. Assalamualaikum warahmatullahi wabarakatuh.